So today's video is on gluteal problems. Gluteal problems will give you pain in your hip, just underneath the belt line or the outer part of the glutes in particular. It can also cause tightness of muscles that flick past the bone and cause bursitis. If you have bursitis, you usually know about it because it hurts on the bony tip of your hip when you lie in bed on that side. And ladies above the age of 50 in particular are prone to that. So gluteal problems can come in association with back problems, or they can be independent of back problems. If they're independent of back problems, it usually means that there's a lack of strength in the glutes, and so you have to strengthen it. So with all muscle problems, there's three things that you can do to help: massage, stretch, and strengthen. Okay, so I'm going to show you massage first of all. Massage you can do yourself with a tennis ball. You lay on the floor, so you need a surface that's quite hard, either carpet or a mat. But I'm just going to do it on the table here just for the sake of this video. You put the tennis ball in the area where it hurts basically, and you lay on your side with your bottom leg bent. If it's bent and relaxed, the tennis ball gets in there more. Okay, so keep that leg bent and relaxed, and you keep this other leg so that you can maneuver around to find the spot, and also take the body weight. You can't put your whole body weight on that spot. You need a pillow too, and you put the pillow just to support your head, and you move around until you find a tender spot. Okay, and then you just lay on that spot for about 30 seconds or so. You'll know if you've got the right spot because it'll hurt quite a lot. Okay, and it's between the bony hip and the waist, so between that area where the belt line is. Okay, and you usually find 2 or 3 spots in there, so you work on each spot for 30 seconds each, so 3 or 4 spots. Don't do any more than that because you can bruise the muscle if you overdo it, because you can do a little bit of that each day. So that helps to get rid of the knots in the muscle. Okay, but as I said, with most gluteal problems, it's because there's a lack of strength in the muscles. So to strengthen the lateral or outer glutes, you do a single leg squat. Now a single leg squat is based on a proper squat. Now a proper squat, instead of squatting like that where your knees come forward over your toes, what you do is you squat back as if you're sitting on a chair, and your knees don't actually go forward over your knees. So your knees don't go forward over your toes. Okay? So you just squat back like that. So when you're doing a single leg squat, you do a single leg version of that. You stand on one leg and you put the other knee similar to in a similar place to the other knee, and then you just squat very slightly down and up again. For some people, if they're quite bad, just standing on that one leg and trying to keep your hips even will be enough. Okay, because you're working that muscle. That's the muscle that controls stabilisation to the side like that. So you can just stand there like that and do that for 30 seconds or so, or you can do 5 to 10 of these. Now my hands will come out just because you're leaning back so much that you fall backwards if you didn't put your hands out to counter weight. Okay? Keep your head up and just try to do it as steady. Now you'll find that if they're quite weak, you'll be wobbling all over the place, and as you improve, that will disappear. So you do 5 or 10 of those, and the better you get, the more you can bend your legs a little bit lower. But it's not really about how far down you get, it's about keeping your balance while you do that. Okay? Now if you get to 5 and you can start to feel like it's getting a bit of a workout, or it's quite warm in there, just stop there. You don't want to overdo it. And so the third thing you then do is you do a stretch of those glutes. So if it was my right glutes here, I would sit on a low chair, cross my leg with my knee out wide as opposed to like that, and then lean forward. And you'll often feel it in that area where you're stretching it. Okay? And you hold that for 20 or 30 seconds, and you might do that a couple of times. Okay? Some people, if they have knee problems, they find they can't do that. So in which case we recommend a lying stretch where you lie on your back and pull your knee towards your opposite elbow. And that way you don't have to bend your knee too much. Okay, so like that or like that. There's lots of different variations that you'll see, but those two are usually the easiest. If you can just feel it stretching the right area, use whatever glute stretch you've been accustomed to. Okay, so as I said, with everything you use strengthening, massage and stretching. And if it continues, let me know and we'll do what we can for you. Okay, thank you.